if somebody gets food poisoning, do you have recommendations of what they can do, or is there anything they can do to then not get SIBO? And can you talk about that? Because people get, very concerned about that.
So there's only one study ever that was done. It was by a Canadian group from McMaster, where they took people who got food poisoning, and then just after the food poisoning, they gave them steroids, which is really kind of like an intense thing to do to try to reduce the immune response to the fact that they got this food poisoning. It didn't change whether they developed IBS or not. And now, understanding what we know today, that was about 12 or 15 years ago, that wouldn't work anyway, because the antibodies would have formed anyway, and it would reduce the inflammation of at the moment you're on the steroids, but it does nothing to the formation of these antibodies. So it makes sense that it didn't work, but they figured there's an immune reaction that's causing it, and so that's why they did the study. But there's nothing you can do once the landscape has been come and done. It's done. So what we do believe, though, is if you can prevent food poisoning, if you're going somewhere on a trip where food poisoning is more common, if you took antibiotics to prevent, that would work the best. If you just were very cautious, that would work if you don't get food poisoning. If you get food poisoning, maybe you should treat it. You shouldn't let it run its course, because the shorter the food poisoning is, the less likely you get IBS. We know that. So these are things that should be considered. But again, the studies to prove that that's true haven't been done. And we've discussed doing these kinds of trials in rats to see, give them the Campylobacter, then give them an antibiotic 12 hours later. Already, Campylobacter is already in there. Can you stop it? And these are very hard studies to do and very expensive, and we have a lot of other things that we want to get at, but it is an important question.